Today we're going to discuss the nursing management of lower GI disorders. Okay, today you're going to identify the cause of and nursing management of constipation and diarrhea, compare Crohn's disease with ulcerative colitis, explain symptoms of irritable bowel syndrome, and describe features and nursing care for appendicitis, peritonitis, and intestinal obstruction, hernias, colon cancer, and colon rectal cancer, and rectal disorders. So, constipation, patho, and assessment. What causes constipation? Slow GI motility, dry, hard stools fewer than 3 BMs a week. Causes: low fiber, dehydration, inactivity, medications, urological muscular disorders. Assessment: bloating, distension, hard stools, rectal pressure, hypoactive bowel sounds. What do we do for it? Interventions: increase fiber, fluids, excessive exercise, avoid overuse of laxatives, stool softeners as prescribed. We're going to assess bowel habits, education on diet and activity, monitor for complications, evaluate regular soft stools, no straining or rectal discomfort. Diarrhea. It's rapid intestinal transit, reduced water absorption, cause infections, food intolerances, medications, or irritable bowel disorder. Assessment: watery stool, urgency, hyperactive bowel sounds, and dehydration. Well, what are we going to do? Rehydrate, give anti-diarrhea agents as long as C. diff has been evaluated and ruled out, because C. diff, you let it run its course. And then we're going to do some dietary adjustments and probiotics. Assess hydration, skin integrity, monitor electrolytes, and patient education. We're going to evaluate, perform stools, maintain hydration, and electrolyte balance. Irritable bowel syndrome. What is it? It's altered bowel motility without inflammation, stress, and diet related. Symptoms: abdominal pain relieved by defecation, bloating, altering diarrhea, and constipation. Dietary modifications, interventions: dietary modifications, fiber, stress management, antispasmodic medications. Evaluation: symptoms reduce, improved quality of life. Crohn's disease versus ulcerative colitis. Crohn's, transmural inflammation, skip lesions, fistula risk anywhere in the GI. Ulcerative colitis, continuous colon inflammation, superficial ulcers, high bleeding risk. Assessment: they're going to have diarrhea, weight loss, and abdominal pain. What do we do? IBS, anti-inflammatory meds, immunosuppressants, nutritional support, skincare. Monitor stools, labs, nutrition, provide emotional support. Evaluate fewer stools, reduced inflammation, stabilized. Appendicitis and peritonitis. Appendicitis is right lower quadrant pain, rebound tenderness, and fever. Peritonitis is severe abdominal pain, rigid abdomen, fever, shock signs. Interventions: pre and post-op care, antibiotics, fluid, and monitor for sepsis. Evaluate stable vitals, reduce pain, no significant infection. Intestinal obstruction, bowel obstruction, mechanical or functional blockage of the intestinal flow. Symptoms involve cramping, distension, vomiting, no bowel movements. Intervention: NPO, NG tube for decompression, IV fluid, surgery if needed. Evaluate, restore bowel function, resolve obstruction, stable labs. Diverticular disorders. Diverticulosis is asymptomatic, little pouches inside the intestine. Diverticulitis, inflammation, left lower quadrant pain, fever, bleeding. This is where food particles get stuck in those little pouches. Interventions: high fiber diet, when stable, antibiotics, and maybe surgery. Evaluation: resolved inflammation, no complications. That's what it looks like, the little pouches. Abdominal hernias, protrusion of intestinal wall through abdominal wall. Symptoms: bulge, pain, strangulation risk. Intervention: surgical repair, truss support, post-op care. Evaluation: healed surgical site, no reoccurrence. This is some examples. Colorectal cancer. Risk, age greater than 50, family history, low fiber, high fat diet. Warning signs, change in bowel habits, blood and stool, anemia. Intervention, surgery, chemotherapy, radiation, colostomy care. Evaluate wound healing, adaptation to treatment, early detection of reoccurrence. That's what it looks like. Anorectal disorder, that's hemorrhoids, fissures, abscesses, fistulas, pyloidal sinus. So symptoms include pain, bleeding, itching. Intervention, sitz bath, analgesic, stool softener, surgery if needed. Evaluation is symptom relief, intact skin, normal elimination. That's what that looks like. Assess GI symptoms, implement targeted interventions, evaluate outcomes, emphasize on patient education, monitoring, long-term management, collaboration with interdisciplinary team to ensure optimal care.